Welcome back. You are still tuned into Good Morning Namibia. And on the conversation of finances, we'll now be taking a look at how finances affect the families of persons with disabilities. Now, in Namibia, families of persons with disabilities face significant direct cost for essential goods and services, which impede full and effective participation in society. Now, while specific comprehensive studies on disability-related household cost in Namibia are lacking, several government and UNICEF reports detail the financial burden and identify many required goods and services. Joining us telephonically with more on the direct cost of disabilities for families in Namibia, goods and services required by persons with disabilities in Namibia, is the Deputy Director of the Disability Affairs from the Office of the Vice President, Mercy Kufuna. Good morning, ma'am, and welcome to the show.
Good morning, and good morning to the listeners.
We understand that there's a launch taking place from the Office of the Vice President to support the importance of direct cost when that affects families of persons with disabilities. Could you tell us more about this launch and how the preparations are coming along for this event set to take place later today at 9 o'clock?
Yes, today, as you indicated, there will be a launch. Specifically, it's a report on the direct cost of persons with disability to families in Namibia. The report was commissioned by UNICEF together with the government, specifically Disability Affairs, now under the Office of the Vice President. So the report will be launched today by Her Excellency, the Vice President of the Republic of Namibia, Honorable Lucia Witbooi, at a special school of persons with disability, which is Backbridge Special School.
Now, ma'am, could you tell us why is this launch significant to the public, and what are some of the topics that we should anticipate at this launch later today?
It's important because I think for many years there has been quite, especially within the disability sector, saying, using terminology that disability is expensive. But that was not quantified in terms of saying it's disability. What are the issues and what are the direct costs or commodities that a person with disability requires, mostly on a day-to-day, to be able to fulfill a quality life. So this report now gives details in terms of what is each type of disability, be it a child, be it an adult, require to be able to fulfill their life. And those commodities or needs are not optional needs. They are important in this report because they are basic needs that are required for a person with disability. So it's important because it will fulfill an important role of informing policymakers and government and even the stakeholders to be able to know on how we can develop programs or commodities that can fulfill that gap, so that, like I emphasize, the most important things, persons with disability can live a quality life and can be able to live independently. So those commodities are important. And now there are details and there is statistics and there is written and it's now documented. So it's important because then there is no assumptions. I think it's a study that was done and it confirms, and even beyond the confirmation of some of the issues that are important.
Now, Ms. Kufuna, you mentioned that there are some essentials that people with their persons with disabilities require to live a quality life. Can you perhaps give us an idea of the types of goods and services that they typically need and they need to pay for?
Just to look at some of the basic needs, or that are there. They are categorized in the report, and some of human assistance. I think for so long we've been saying persons with disability require an assistant. That is somebody that will take care. And some of the disability, like when you have, so you require assistance for almost 24 hours a day. And that is required. So in terms of being taken care of for activities of daily living up to that level where sometimes even, being taken outside and all the other needs. And we've got assistive technology. It's quite important. Those also are important, for example, wheelchairs, medical bed, prosthetics. We all know crutches and walking frames, braces. All those are important. And we've got things that require, for example, even if you acquire disability today, your whole home must be modified. And those are basic needs because you won't have the same mobility needs like when you don't have a disability. For example, having ramps at the home, widening your doors, your toilets, and this is what we say even in public places. A person with disability won't be able to use the same toilet like others because the door must be widened, the door must open from outside. So those are some of the home modification needs. And education, which is critical. It's critical in such a way that for us to be able to get to tertiary education for persons with disability, we must deal very well with education, particularly at primary and ECD level. And these are, for example, writing pads, table adaptation for wheelchair, because then if a child, you have got to bring that table to the level where the wheelchair is. Even adapting pens and pads, tape recorders. And we know tape recorders are, for those that are visually impaired, they use certain methods of, how to get information. So that is also critical. It's a need. In terms of health care, and we talk about therapists, it's a cost to have health care, and some of the health care that are needed are very specific. The occupational therapist, the speech therapist, the audiologist. So all those professionals are cost. And and then transportation, accessibility is not the same as when you need transport, because you've got to travel from the village if there is a distance with your wheelchair, so the needs are different. And we've seen sometimes, even the transport industry, some of the taxi drivers say, I've got to pick this person, I've got to do the wheelchair. So at some point, I'm told the clients are charged twice because you are having a wheelchair. All those issues are costly. So they are really just the issues. And if, like I alluded, I went to the categories, you can see these are basic needs. The human assistance, assistive devices, home modification, education, health, transport. Particularly, there's nothing that is not significant. They are all important and they are all basic needs, and they are needed by persons with disability on a daily basis to be able to fulfill a quality life.
Funa, thank you so much for that comprehensive explanation. But if you could tell us in short, what are some of the changes or outcomes that you'd like to see that come from the launch of this report today?
I think more of the outcome is going forward, proper budgeting, maybe having more awareness on key stakeholders to understand the importance of some of these roles and these needs, and being able to the budget to respond to some of these needs. So that I think that is critical. So that we when we budget looking at the needs. I think for so long we've been speaking about the issue of personal assistance. And that is one issue that's critical. And it's not only critical on say human assistance at home. We also talk of having more assistance at schools, or having more assistance at facilities that cater for children or adults with disabilities.
Much for providing us with insight on the launch that will be taking place of the report of the effects of the direct cost of disabilities for families in Namibia, Ms. Kufuna.
Sorry?
Thank you so much for your time this morning and providing us with more insight on the launch that will be taking place later today.
Thank you.